Thank you for joining us. By way of introduction, my name is June Kernigan. I work in the Garland office alongside Perla and Gary May. Last year, Prism instituted some cost-saving initiatives with some structure changes that were aimed at saving costs over the long haul. Our wellness program is off to a fantastic start as you, our employees, also took steps to watch out for your long-term Medicare care costs as well. The participation in our biometric screening was great, starting and continuing annual exams that are free. You made improvements as well. Walking more and changing eating habits were adopted, and all of these have made a noticeable impact on our claim costs for the past year. Prism is fortunate to have employees that have made these steps part of their personal health care routines. And not only has yours and the company's costs been positively impacted, personal health and well-being is up for which there is no adequate measure of this benefit. Thanks to you, and keep up the good work. Encourage your co-workers to also join in. In the next 30 minutes or so, we're going to review the insurance benefits. To simplify the process, we have broken the insurance benefits into separate presentation for ease of understanding and for your convenience. The introduction presentation, which you're currently viewing, will address the enrollment window, plan year, eligibility, qualifying events, terminology, and what happens if you do not make a medical election. We will be introducing a new online enrollment service called bswift, a new employee assistance program, a new vision carrier, MES. Separate presentations were taped for medical, one for dental, one for vision, and so on. We also have to advise you that the annual disclosure and notices for those of you who have or will become eligible for Medicare in the next 12 months. These notices include Medicare Part D, credible and non-credible, Medicaid and the Children's Health Insurance Program, known as CHIPS, Women's Health Cancer Right Act, special enrollment notices, and the Newborn Act disclosure will be available under the News and Library section of bswift. It'll be difficult for you to remember everything we discussed today, so please review the presentations as needed. The benefit enrollment guide will still be available on the new bswift website for you to use as a reference. If you need assistance with the enrollment process, Perla and I will be available during the work week until 6 p.m. On Saturday, August 3rd and on Saturday, August 10th, we will be available from 8 a.m. to 11:30 a.m. For Spanish, please contact Perla at 214-380-5558. For English, please call June 214-380-5515. Also, when you're ready to enroll, please have all of your dependent information ready to go. Our policy year runs from September 1st, 2013 through August 31st, 2014. Open enrollment is an opportunity to make changes. This is also an opportunity for you to review your beneficiaries and your 401k beneficiaries. One important note to mention is the plan year is September 1st through August 31st. However, our deductibles are based on calendar year, January through December, and that's for tax reporting purposes. The elections you make during open enrollment will take effect September 1st through August 31st. The new online service will be available 24 hours a day, 7 days a week, beginning August 1st through August 11th, and allows you an opportunity to review the benefits with your spouse and elect or make changes to your current plan. Employees who are currently eligible and reduce their hours below 30 or more hours per week will be eligible to enroll in COBRA to continue their plan elections, whereas part-time employees who increase their hours to 30 or more will be eligible to enroll in the insurance. Dependents, if your dependents, which include your spouse, has a different last name than yours, you may be asked to provide documentation to support dependent status, such as a tax return or a court order or medical support or even a marriage certificate. The reason to confirm dependent coverage is to control medical costs. If you're a new hire, coverage begins the first of the month following 90 days of employment. Coverage end date for medical, basic life, and disability insurance will end the same day that employment ends. Dental and vision ends the last day of the month that employment ended. Sterling HSA is our COBRA administrator. They will be sending out the first COBRA Right letter when you enrolled in benefits. They are also the carrier who will be sending out the information and application for you to elect COBRA. Let's discuss qualifying event. Changes in coverage outside of open enrollment are allowed only for a qualifying event. What's a qualifying event? A marriage or divorce, a death, birth, or an adoption. If your spouse gains or loses employment, a gain and loss of dependent coverage. You have 31 days from the date of the event to make the change. Documentation supporting the event, the marriage license, divorce papers, birth announcements from a hospital or birth certificate, or a termination or a new hire notice from the spouse's place of employment are required. Why? Because we do not pay taxes on your benefits, and the IRS steps in and controls when you can leave or enter a plan. Medical elections. Please note, if you do not make a medical election and you do not indicate you have other coverage, you will be placed on the Health Reimbursement Plan, or the HRA. This plan offers limited coverage through a high deductible health plan, which will help protect you from a high health care expenses that could arise in the case of a serious non-work related illness or injury. An explanation of the HRA plan will be discussed in the medical presentation. Let's address some terms to know. What is an EOB, an explanation of benefits? You will receive one every time you go to the doctor's office or a facility. An EOB is provided by Group and Pension Administration. They are the company who discounts our medical claims and submits them to Prism for payment. The EOB shows the name of the doctor who submitted the claim, the date the service was provided, and what procedure was performed, usually in code, and what the charges are. This is an example of what an explanation of benefit is. Some of the items I want you to be concerned with is on the right side, lower left or lower right. It'll show you if you've met your deductible. Number 15, if you can see that, will show what your charges are. Please take a moment. Don't discard these. They're very important when you're paying your bills to your providers. Let's address balance billing now that we talked about an explanation of benefits. When a doctor's office asks you to pay the difference between their contracted amount and what they have agreed to and what they would normally charge without a contract, if you receive a bill from a doctor or a facility's office, refer back to the EOB for that doctor before you make a payment. Be prepared. If you have a hospital stay, you will receive an EOB from every doctor or lab who worked on you. We have a service included with our insurance called Nurse Navigator, whose name is appropriate because they can navigate through the explanation of benefits and assist you with them if needed. You can reach the Nurse Navigator by calling the number at the top of your Prism ID card. Coinsurance. Coinsurance is a shared amount between you and the insurance company. We pay a percent, you pay a percent. Out-of-pocket maximum, the total amount paid each year by the member for a deductible and coinsurance. After reaching the out-of-pocket maximum, the plan pays 100% of the allowable charges for cover services for the rest of the calendar year. In-network and out-of-network. In-network refers to physicians, hospitals, or other healthcare providers who contract with health plans to provide services to its members. Coverage for services received from an in-network provider will typically be greater than services from an out-of-network provider, depending on the plan, of course. Out-of-network refers to physicians, hospitals, or other healthcare providers who do not contract with a health plan, and they can charge whatever they'd like. I'd like to introduce you to bswift. bswift is not only an online enrollment service, it offers Best Fit Plan Advisor, a one-click Spanish translation, and a total compensation statement, which will enable you to know exactly what your weekly payroll deductions will be before you submit the elections. You will also have the ability to print and save the statement. The service will also house videos, the benefit guide, and company communications. We will be using bswift website and enrolling online. Your personalized site will be password protected. You will see a welcome box on the home page that will instruct you on how to register on the site. The username will be the first initial of your first name plus your last name. For example, my username would be J. Kernigan. The password will initially be the last 4 digits of your Social Security number, which you will be asked to change once you log on for the first time. At the top of the screen is a button to change the screen to Spanish. The next line is My Profile, which you can review addresses. Continue to the right to find the news and library. The same information is located on the right side of the screen. On the left side of the screen is the benefit election. A check will appear once you've completed that section. Once you're ready to make your elections, please have all dependent information ready, such as names, date of birth, and Social Security numbers. Employees who do not have a computer or access to one are welcome to contact the Human Resource Department for assistance. Employees needing Spanish assistance will contact Perla. All English assistants will contact June. Perla and I will be available Saturday, August 3rd and Saturday, August 10th from 8 a.m. to 11:30 a.m. Best Fit Plan Advisor tool on bSwift, which will calculate the actual cost of your election. You will be asked certain questions about the previous year. Using the information you provide, the system will help select a plan that may fit your pocket and your medical needs. You will have the ability to review the election and your total cost per payroll and go back and make changes if needed. You can also print a copy for your file. Once you've made your elections, please contact me and provide feedback. It'll be the first time during open enrollment that all of the information needed, including regulatory compliance, will be in one location. I would like to introduce you to the newest member of our benefit group, Interface EAP, Employee Assistance Program. The program offers grief crisis line, legal assistance, and financial counseling. Of course, my favorite, wellness resources. It has a work-life database for child and elder care. It has education material, download tip sheets, checklists, articles, and licensing requirement. It also has well tips, personal health profiles, gym discounts, well wait, well walk, and well quit. This concludes the introductory portion of the presentation.